Hello everyone and welcome. My name is Omar Ali. I have partnered with Sarah Barker for this project for EDAC 634 Module 2. The name of the module is Andragogy, Self-Directed Learning and McCluskey Theory of Margin. So we were tasked in using one or multiple theories that we learned to plan and implement an educational offering. We chose experienced nurses as the population, and we chose the literature review as the task that we are teaching. And we chose these because we based our development of the content on Knowles's theory. And so Knowles's framework theory has different assumptions. We chose 3 of those assumptions, and we feel that those assumptions really apply to our learners. Our first assumption is experience as a source of learning, that adult learners bring a wealth of information to learning new skills or new knowledge, and that is really beneficial to the adult learner when they're able to combine what they learn in the offering that you have and what they already have experienced. And the second assumption is a readiness to learn. Experienced nurses often reach a point in their career where they recognize they need to supplement the knowledge gained in practice with other sources of information. And our third assumption from Knowles's framework is immediate application. And that is the educator has to make a compelling argument that the content is useful and can be applied immediately to practice. And in our situation here, we are hoping that the expert nurse is able to perform a basic literature review by the end of this presentation. So in this presentation, we have 3 main objectives. Our first objective is to have our learners identify a problem in practice. And that is helping our learners examine their practice and noting some sort of issue or problem that requires more information to solve or to mitigate the negative effects of that problem. After we identify that problem, we want to jot down some keywords, and we want to use these keywords to formulate a research question. This research question captures the goal of our literature review, right? What is it that we want to learn? Who do we want to learn it for? And then after that, once we have this research question, then hopefully we want to see our learners demonstrate the steps of a basic literature review. We plan to show the hopefully straightforward steps that our experienced nurses can take to locate their first set of articles to help them answer their research question. So the first step is to identify the problem in practice, right? So this is what you would call the gap in knowledge, right? Or the gap in skills. For our example here, we decided to choose heart failure patients and salt intake. So just a little background on heart failure patients. Often heart failure patients are prescribed a strict regimen of limitations on their salt intake. This is very hard for a lot of individuals to comply with. When heart failure patients eat more salt than is prescribed, they can gather fluid rather easily around their lungs and around their other parts of their body, which can make it hard for them to breathe. So it's really important that we try to find novel methods or supporting evidence to help us do some teaching to our heart failure patients to limit their salt intake. So in thinking about our research question, we want to use these keywords, and these keywords may change as you get into your search here. We are going to look at heart failure, SALT, compliance, and patient education. And hopefully using three of those, we can land on some articles that can help us with our research question, which is what are the best teaching methods to increase compliance with salt intake guidelines for heart failure patients? Basically, how do we best teach our heart failure patients to limit their salt intake so we can prevent them from having these adverse effects and for them to be readmitted. So for our example here, I am using the intranet page of Eskenazi Health, and that is my employer. That's where I teach. The audience for this session would be experienced nurses at my hospital, although it can be used for nurses everywhere. But for our purposes, we are going to look at the home page, and I want to go step by step and show our learners how to find the databases so they can start their first literature search. So from the home page, you'll see a quick links box at the bottom of the page. What you want to do is you want to click on EBSCO. Now, EBSCO is basically a organization that houses various databases for academic literature and non-scientific writings. And after you do that, this is the screen you'll get, and you want to click on CINAHL. Now, this is the most common database that we use in nursing, and it stands for Cumulative Index to Nursing and Allied Health Literature, which basically means this database houses articles mainly focused on patient care and other things associated with healthcare professionals. So we're going to click on that. And then we get this screen where it asks us to enter our keywords. So if you remember our keywords from the very beginning of the presentation, they included heart failure, salt intake, and compliance. So we're going to search those. However, before we do that, we want to maximize our search results. And we're going to click where it says there, choose databases. And this just allows us to search more databases for our topic, and then hopefully it will allow us to get more relevant articles. So after that, you've chosen all your databases, you've entered your 3 keywords, and you basically hit search. So after you hit search, you're going to get a large amount of articles. It's important then at this step to filter your results. You want to find full text articles because you want to be able to read these articles and apply what you've learned. But you also want to find good quality articles. And what we mean by that is articles that are peer-reviewed. And that means that articles that are written by scholars and reviewed by scholars in their field. And this just increases the quality of evidence, and it helps us come with more informed and evidence-based interventions for our problem in practice. I hope this short presentation has shed a little light on a task of performing your first literature review. It is important to think of it maybe as 4 different steps that can guide you in your first review. The first is to identify a teaching or learning need in practice. Then is to just sit down and note some keywords, some words that are related to the problem that you've identified. Using those words to formulate a research question, and that is the question of what you ultimately want to solve or demonstrate. And then you do your search And then you can filter the results, right? You want to filter results that can provide you full text articles and identify articles that are peer-reviewed. That is, articles that are of a higher standard of work that is performed by scholars and reviewed by other scholars. So I appreciate everybody's time in reviewing this short presentation. Like I said, I hope it has been helpful to experienced nurses or anybody who wants to take that first step and perform their first literature review. So thank you, everybody, and we'll see you for our next module.